Hi, my name's Gemma and I'm one of the pharmacists at Royal Stoke Hospital. After having a myocardial infarction, you still have a small residual risk of another heart attack, so we'll start you on some medications which will prevent a further myocardial infarction. The optimum treatment would be to be started on 5 medications. That's 2 antiplatelets, this will be aspirin, and then you'll be on either clopidogrel, ticagrelor or prasugrel. We'll also commence you on a statin. For example, this could be atorvastatin. We'll also start you on a beta blocker, for example, bisoprolol, and an angiotensin converting enzyme inhibitor such as ramipril, or an angiotensin receptor antagonist such as losartan. We may also start you on a GTN spray or a GTN tablet. These medications should help prevent any further myocardial infarctions and optimize the heart's pumping ability. Some of your pre-existing medications may be stopped or altered to allow these medications to be commenced. If you experience any chest pain, discomfort, make sure you sit down and take a rest. If your pain persists, then take 1 to 2 sprays under your tongue or 1 tablet and wait 5 minutes. If the pain still persists, do the same again. Take 1 to 2 sprays of your GTN under your tongue or 1 tablet and wait 5 minutes. If the pain still persists at this point, you should phone 999 and make sure that your front door is unlocked. The GTN spray should be with you at all times. If you haven't used it in a while, you should spray 1 to 2 sprays into the air before using it. You need to make sure that these are kept in date at all times, and you should sit down while taking it as it may make you feel lightheaded. And do not swallow the tablet, this should be left under your tongue to dissolve. The most important treatment for heart failure is diagnosing the cause, and we will treat this. For heart failure with reduced ejection fraction, you will be started on 4 medications. This will be an angiotensin converting enzyme inhibitor, such as ramipril, and an angiotensin receptor antagonist with a neprilysin inhibitor. This will be called Entresto. You'll also be started on a beta blocker, such as bisoprolol, a mineralocorticoid receptor antagonist, such as spironolactone or eplerenone, and a sodium glucose cotransporter 2 inhibitor such as dapagliflozin. These medications will help to slow the progress of heart failure and will also help to relieve symptoms. You may also be started on a diuretic such as furosemide. This is to reduce the fluid overload and to ensure that you maintain a normal fluid balance. The dose and frequency of these medications may be adjusted and monitored to ensure optimum treatment. You should ensure to take the medications at the correct time to ensure you have the optimum level of drug in your body at all times. We understand this might be difficult to do, especially if you're not used to taking medications and have recently been started on multiple. Tips to do this are to either tie this to a normal routine, such as when you go to bed or when you brush your teeth, or to set an alarm in your phone. If traveling, make sure that you take plenty of medications with you, ensuring you have plenty in case of delays. If you accidentally miss a dose, do not double up on your dose, as this can cause side effects. Make sure you read the patient information leaflet which will have been given to you with your medications, as this can often give you the answer as to what to do during this time. If you have any questions, contact your GP or your community pharmacist. All medications come with side effects. The side effects are often mild and the risks and benefits will have been weighed up and the benefit will have been deemed to outweigh the risk. If you experience any unexplained muscle aches or pains, this could be due to the statin. You should seek advice from your GP or your pharmacist, although true myopathy due to statins is rare. You may also experience dizziness or lightheadedness from these medications. If this happens, sit down. You should contact your GP or your cardiologist, as the medications can be titrated or the time of day can be altered to reduce these symptoms. Ramipril can cause a dry cough. If this happens, contact your GP. The potential side effects can vary depending on medications. The patient information leaflet within your medication box will include information on this. Usually you will only continue dual antiplatelet treatment for 12 months. After this, you will continue on single antiplatelet treatment. A tip is to mark this date in your calendar so that you know when to reduce down to single antiplatelet therapy. The doses and the frequency of your medications can change. They can be titrated up or down to optimize your treatment. You should continue taking these medications unless told otherwise by a healthcare professional. Any alcohol intake should be within moderation, and if you're on warfarin, the alcohol may alter your INR. You should avoid grapefruit juice when taking statin therapy. If you have heart failure, you'll be given individual advice regarding fluid intake, and you should follow any general health advice regarding a healthy diet. You can contact your GP, you can contact your community pharmacy, you can contact any specialist team who you have been referred to, and you can contact the medicines information team who you'll have been given a leaflet for within your medications. When you were discharged, your medication letter will have been sent across to your GP electronically. They should now issue your medications as a repeat. You can collect your prescription from your GP, and this can be taken to any community pharmacy.